Today we're going to be talking about chemo, diet, and workouts during chemo. My first chemo treatment was 6 weeks after my hysterectomy. It was enough time that my incisions had pretty much healed, so I was comfortable sitting in the chair that day, so it wasn't an issue at all. I would recommend having someone go with you, at least to get you set up, even if they're not there with you all day. It's helpful to have someone there at the beginning of your treatment, and then having someone pick you up because you're going to be a little out of it when you're done with your treatment. What I brought to chemo was a sweater, I wore socks, and I had headphones for my phone because I had a cold cap. It was easier for them to sit over my ears. So that's what I did, and I listened to Audible. I had some downloads of Netflix so I could watch some favorite movies, and that got me through. But because they give you Benadryl, you may even be able to nap. I wasn't able to really nap. I was pretty much awake, but you never know, you could fall asleep, and that'd be great if you could just fall asleep and get it over with. What they gave me was carboplatin and paclitaxel, which is also called Taxol. So they give you the Benadryl so that you don't have any side effects. The one thing I noticed after my first treatment is I had flushed skin the day after, and they told me just to take Claritin 24 to clear that up, and it did clear it up. So going forward, what I did is I would take Benadryl the night before chemo and Claritin 24 the day after chemo, and between the two, I never really had any other allergic reactions. The other big thing is to drink a lot of water throughout chemo. And then especially the week of chemo, I was very careful about what I did. I used Miralax to make sure I didn't get constipated, even though that's not an issue I usually have, but the drugs cause you to have constipation. I took ginger tablets to make sure to help with my nausea. And I also drank a lot of water before and after treatments. And I rested. After chemo, expect that the day after chemo, probably 2 days after chemo, you really have to rest. You're going to feel fatigued. At least I did. The other thing that happened was on my second treatment is where I started to see a loss of hair. They came out in clumps when I was washing my hair or brushing my hair. It wasn't noticeable because I had a lot of hair, but to me it was noticeable. And then on my third treatment is when I got a few bald spots. I came home, I took off the cold cap, and the cold cap, you put conditioner on your hair so it doesn't get stuck to the cold cap. So I washed my hair, and when I washed my hair, that's when the issues started. And I'll talk about that in a later video. I'll give you more detail about hair loss and my thoughts on that. Between treatment 4 and treatment 6, I ended up fasting for 36 hours prior to the day of treatment. I ate when I got home, even though the recommendation is not to eat. There are a few studies done on humans about fasting at this point, but the idea is that fasting appears to both reduce toxicity and increase the efficacy of chemotherapy. The timing is supposed to be 36 to 48 hours before treatment, and depending on the afterlife of the chemo drug, you would fast that much more time after the chemo treatment. I personally didn't do that. I probably should have, but I just didn't do it. I was hungry. I had a small meal after chemotherapy, and then I would eat again the next day as normal. The idea is that the chemo drugs attack the fast-growing cancer cells and not your normal cells if you fast. So that's what I did. My doctor didn't recommend my doing this, but I did it on my own, and I did have minimal side effects. Maybe it helped me, maybe it didn't. I don't know. The other thing they may do is give you Neulasta. What I would recommend about Neulasta is do not get it wet. Neulasta is a little plastic thing that they put on your arm, and it releases the drug 24 hours after chemotherapy. One of the nurses had told me that I could take a shower with it, but what happened the time that I did take a shower is that even though it was still stuck to my arm, it was a little loose. And I think the needle that's beneath it was kind of irritating my arm, so that was really annoying. I would not recommend getting it wet. Just wait 24 hours, shower with a shower head. Just don't touch that area. It's much more comfortable if it's not wet. The chemo symptoms that I had after my treatment was fatigue. I had a little bit of my gums bleeding. So what I did for that is they told me to just keep a bottle of water with sea salt in your bathroom, and just every time you go to the bathroom, just rinse your mouth, and that helped tremendously. So I would highly recommend using the sea salt with water, mouthwash, as much as possible, and that will really help with your gums if you have that issue. Constipation is the other thing that's caused by the chemo drugs. What I did is I took whatever the doctors gave me for that, and I also used Miralax the week leading up to the chemo and then a couple of days after chemo, and that helped keep me regular. Even though I don't have issues with that, I did notice that the difference with those drugs, the first treatment where I didn't do Miralax, and I don't think I used the constipation medicine that they gave me, I did have a little bit of difficulty. So I would say definitely take what they give you. As far as nausea, I had nausea by the third treatment. I guess because chemo is cumulative, I didn't really have the nausea at the beginning, but I did as the time went on. By the fourth treatment to the end, I was taking the nausea medicine that they were giving me, and I was also using ginger tablets and ginger powder in my smoothies just to help with nausea. I never did throw up, but I could say all in all I had about 3-4 days where I was kind of up, down and out, and I just could not really sit up, so I would just lay down, and that helped me feel better. I had saltines, ginger ale, things like that to help with the nausea, and then it would just pass. So it wasn't too horrible, at least in my case it wasn't too horrible. The other thing I did was take magnesium supplements at night. That helps with sleep, and that also helps fight constipation. And also rest. I rested 2-3 days after chemo. I really didn't do a lot other than my walks, maybe a little cooking, but not a lot. I would just really rest and try to make myself come back to normal as much as possible. So I didn't really work. What I found helpful was scheduling the chemo on a Thursday or Friday. That way you have the weekend to recover. If you are intending to work during chemo, I would recommend doing that. So after each chemo treatment, this is what I did. On day 2, after removing the Neulasta, I would take an Epsom salt bath with bentonite clay, which helps with detoxification. The timing that I read was if you stay in the bath for about 40 minutes, that helps with the detoxify. Then I would also do a bentonite clay mask mixed with apple cider vinegar. So all you do is take a little bit of like a tablespoon or 2 of bentonite clay, and you put enough apple cider vinegar to make a paste, and I would put it all over my face. You could also put it on your underarms if you want to hit your lymph nodes, and just keep it on for like 15 minutes. It hardens and wash it off. I just felt like it detoxifies you. That's what bentonite clay is known for. So I'm still doing that, which is great. I love bentonite clay. And then of course, drink lots of water. That's key for detoxing. And do your daily walks, 30 to 60 minutes. I found that Neulasta caused my body aches. And I found that walking was the one thing that helped me get rid of the body aches. Even though it sounds counterintuitive that you're gonna walk when you're kind of feeling achy, but for whatever reason, walking, I guess, gets everything moving, and it really helped me get rid of the aches and pains. So I would walk after coming back from that chemo day. I would do like a 30-minute walk, and then the day after I would do 30-40 minutes up to an hour of walking. Nothing brisk, just a regular walk, and it really helped me out. I incorporated yoga and some Pilates just to get those aches and pains out during the time that before my arms started to swell on treatment 5. So at the beginning of my chemo, I was able to do quite a bit of working out, meaning yoga and Pilates and things like that, just to keep me going. Because prior to chemo and all this, I was used to working out, with weights and HIIT exercises and all sorts of stuff. I couldn't really do all that because I felt fatigued, but I was able to do yoga, Pilates, walking. And even for someone that doesn't work out, I would definitely say at least walk and stretch. It really helps out. So I also use detox foot pads that they sell on Amazon. I don't know if they helped or not, but they're supposed to help detox you. You're supposed to use them for 5 days straight in order to detox. So I would use them after every chemo treatment. And as I mentioned, I also took Claritin 24 the day after chemo, which seemed to help with any flushed cheeks or rashes. So to keep nausea at bay, what I did is I had light meals the day that I felt kind of nauseous. And just listen to your body. It'll tell you what you could eat. For me, it was saltines, ginger ale. I craved watermelon for some reason, maybe because it was summertime, I'm not sure. The other thing I had was smoothies. I was able to tolerate those. So at least I was getting the nutrients that I needed. So I never really had an issue with my iron levels during chemo, which was great. One of the things I did is I did take iron supplements over the counter, and I made sure that I had a lot of dark greens and 2 smoothies a day. So things like that I think helped with how my body reacted during chemo. So as far as food during chemo, I tried to focus on having things like lots of kale, spinach, collard greens, tofu, legumes like black beans, chickpeas, things like that, so that I was getting nutrients with every meal that I had. I really tried to focus on having good meals. And of course I had my favorites, like days that I really didn't want to eat. Like one of my favorite things is Caesar salad. So I would just make a Caesar salad and most likely I would eat it. And then the thing to do is like really just listen to your body and see what it feels like you want to have. So if you want to keep weight gain at a minimal, try to make healthy choices at this time. Even though like my doctor told me just eat whatever you want at this time, thinking that maybe I would be throwing up, but I never did. And so I just kept it pretty clean and healthy through my treatment. And it also helps you feel better as well if you're eating well. The other thing I did was focus on my iron intake. So I would use pumpkin seeds, walnuts, almonds in my salads, which adds quite a bit of iron. I also took a vegan over-the-counter iron supplement that probably helped me out. I never had to do an iron IV, thank goodness, because if I did, I can't imagine they had difficulty by the end trying to find the vein. So I'm really happy that didn't have to happen. So the other thing I did was also focus on anti-inflammatory type of food. What I'll do is link down below, if you want a download of this, a list of what they mean by anti-inflammatory food. I'll include meats in there as well, although I don't eat meat, but at least I'll show you, for anyone out there that does eat meat, you'll see what's on the list of anti-inflammatory choices for you. And I'll even throw a couple of smoothies in there for you. I'll tell you, give you a list of things that I used. So click on the link below if you want to see that. As far as workouts, I talked about that. I just keep walking and stretching as much as you could. Just do what you can, whatever makes you feel good, and just listen to your body at the end of the day. Next up, we're going to be talking about hair loss, and stay tuned for that. I'll tell you exactly how I felt. I wish I had filmed it during that time, but I wasn't really vlogging at that time. I do have pictures, so I'm going to show you a timeline of what happened to me, and I'll just talk about how I felt about it and what I went through. So click on the next video if you want to see more about this.
you.